Hello everyone, my name is Dr Ourania Varsou. I'm a senior lecturer in anatomy, and today we will be running through ocular ultrasound. This is one of the most difficult ultrasound techniques that we can do, and I will be explaining the transverse scan of the eye, and we will also be doing a quick coronal scan to see the reaction of the pupil to light. So in terms of learning outcomes, we will learn about the eye orientation, but also how to interpret subtle variations in homogeneity within the human eye. So here we have a transverse section of the eye. At the top, towards the top of the screen, we can see the eyelid. And as the sound waves progress, we can see deeper structures within the eye. At the top of the screen, we see the green dot that corresponds to the right side of the volunteer's eye. So that's just for orientation. And as we progress down, we can see very nicely the retina and the choroid plexus just posterior to the vitreous body. And if I was to look again from the top down, we see on this scan just now the eyelid, the lens very nicely separating the anterior from the posterior segment, and then on the posterior aspect of the vitreous body we see again the retina and the choroid plexus. And now very nicely we also saw part of the optic nerve, which becomes much clearer now on the second clip. Now we have changed our view, and instead of transverse, we have a coronal scan of the volunteer's eye, and here we're going to do something slightly different. So here we can see very nicely the iris and the pupil in the center. This is quite an extremely difficult technique to get right. So what we have done is we have put a probe and we have rested it on the zygomatic bone of the volunteer, and then the sound waves are going right through the iris and the pupil, which we just saw on the screen here. At the same time, we are asking the volunteer to open the contralateral eye, to which we are showing a bright light to see the pupillary reflex, which we can just get a glimpse of just about here.